in Chembur. The name of my clinic is Agrawal Heart and Women Care, and I'm attached to various hospitals like Zen Hospital, Apollo Hospital, SRV Hospital, and a few nursing homes in Chembur. So today the topic that I'm going to talk about is anemia in pregnancy. So the question here is, why does anemia occur in pregnancy? अनीमिया मतलब जिसे हम खून की कमी बोलते हैं या कहते हैं, वो प्रेगनेंसी में क्यों होता है? क्योंकि प्रेगनेंसी में अपना ब्लड वॉल्यूम मतलब जितना ब्लड अपने शरीर में होता है वो बढ़ जाता है. द ब्लड वॉल्यूम इन योर बॉडी इंक्रीजेस. आरबीसीज उतने नहीं बढ़ते हैं. आरबीसीज जिसे हम लाल पेशियां बोलते हैं. इसीलिए प्रेगनेंसी में अनीमिया या खून की कमी होती है. माइल्ड अनीमिया या थोड़ा अनीमिया होना प्रेगनेंसी में नॉर्मल है. So the big question is, how do you know that you have anemia in pregnancy? तो उसके काफी सारे सिम्टम्स भी होते हैं. फीलिंग वेरी टायर्ड, बहुत थकान आना, आपकी स्किन, आपके नाखून, आपके आईज वाइट दिखना, पेल दिखना, और फीलिंग डिजीनेस, चक्कर आना बार बार, डिफिकल्टी इन ब्रीथिंग, सांस लेने में तकलीफ होना, rapid heartbeat, you can feel your heartbeat, what is also called as palpitations, धड़कन बढ़ जाना. All these are nothing but symptoms of anemia in pregnancy. So there are different types of anemia that can occur. How do you know? Your gynecologist will help you diagnose anemia in pregnancy. It is done by a few simple blood reports like your hemoglobin levels and certain other reports. मतलब ये blood test से आपको समझ सकता है कि आपको अनीमिया है या नहीं है, और अगर होगा तो किस टाइप का अनीमिया है. So the first type of anemia that we commonly see in pregnancy is also called as iron deficiency anemia. इसमें बॉडी में आयरन की कमी होती है. There is decrease in the iron in your body. It is the most common type of anemia that we encounter during pregnancy and the most easily treatable as well. दूसरे जो दो टाइप्स के अनीमिया होते हैं, they are because of deficiency of two other vitamins in your body, namely folic acid and vitamin B12. मोर कॉमनली मतलब ज्यादातर ये उन लोगों में देखे जाते हैं जो प्योर वेजिटेरियंस होते हैं, क्योंकि फॉलिक एसिड और विटामिन B12 अपनी सब्जियों में कम ही होता है, और नॉन वेजिटेरियन चीजें जैसे कि एग्स और दूसरे जो चिकन मीट्स होते हैं उनमें ज्यादा तरह होता है. सो इंडियन डाइट्स, स्पेशली वेजिटेरियन डाइट्स में फॉलिक एसिड और विटामिन B12 की कमतरता होती है, एंड वी डू टेंड टू बी डेफिशिएंट इन. तो क्या प्रॉब्लम्स होते हैं इससे? ये टाइप ऑफ अनीमिया से बेबी का वजन कम हो सकता है. बेबी कैन बी लो बर्थ वेट ड्यूरिंग डिलीवरी. प्रीटर्म लेबर मींस डिलीवरी के डेट के पहले ही प्रेगनेंसी के पेन्स चालू हो सकते हैं. बेबी में कुछ प्रॉब्लम्स भी हो सकते हैं अगर प्रेगनेंसी रहने के पहले या जब भी प्रेगनेंसी डेवलप होती है, जो पहले 4 से 9 हफ्ते के बीच में होता है. अगर फॉलिक एसिड विटामिन B12 लेवल शरीर में लो है तो बेबी में काफी डिफेक्ट्स हो सकते हैं, जिन्हें हम न्यूरल ट्यूब डिफेक्ट्स करके भी बोल सकते हैं. दूसरी टाइप का अनीमिया जो होता है, अगर बहुत ही ब्लड लॉस हो प्रेगनेंसी में, जैसे प्रेगनेंसी के पहले हो, ड्यूरिंग डिलीवरी हो या डिलीवरी के बाद हो, इन सब के वजह से भी अनीमिया प्रेगनेंसी में हो सकता है. What are the risk factors of having anemia in pregnancy? किन लोगों में अनीमिया होने के चांसेस ज्यादा होते हैं? अगर मल्टीपल प्रेगनेंसी हो, जैसे आपके पेट में एक से ज्यादा बच्चे हो, ट्विन्स में, ट्रिपलेट्स में अनीमिया होने के ज्यादा चांसेस होते हैं. Pregnancies which are closely spaced means if you have gotten pregnant within less than 2 years or within 1.5 years of your previous pregnancy, then yes, you have a more chance of developing anemia. अगर पहले 3 महीनों में there is a lot of vomiting which is involved, you are unable to really eat anything, yes, you have a chance of being more anemic. अगर आपका डाइट आयरन में कम है, अगर आप वो सब चीजें नहीं खा रहे हैं जिनसे आयरन आपको मिल सकता है, तो यस, आपको अनीमिया होने के ज्यादा चांसेस है. और अगर प्रेग्नेंट रहने के पहले आप अनीमिक है, आपका हीमोग्लोबिन कम है, तो प्रेगनेंसी में अनीमिया होने के आपके चांसेस डेफिनेटली बढ़ जाते हैं. So the question here is, how do you know that you have anemia? Like I already said, your gynecologist or any doctor that you go to will advise a simple blood test, which is called as a complete blood count, which gives us an idea about the hemoglobin level. The normal hemoglobin during pregnancy should be somewhere between 10 to 11. इससे अगर hemoglobin कम होता है तो उसे anemia in pregnancy कहते हैं. Depending on आपका hemoglobin कितना है, it is further categorized into mild, moderate and severe, और आपके treatment measures उससे बदलते हैं. So the question is कि कितने बार आपको ये CBC करना जरूरी है. अगर आपका हीमोग्लोबिन नॉर्मल है तो फर्स्ट टाइम आपको समझ रहा है कि आप प्रेग्नेंट है, एक बार आपके सेकेंड ट्राइमेस्टर में, मतलब 3 से 7वें महीने के बीच में एक बार, और 7वें महीने के बाद कम से कम एक बार ये हीमोग्लोबिन का चेकअप होना चाहिए. अगर ये कोई भी चेकअप में आपका हीमोग्लोबिन कम हो एंड इफ यू आर डायग्नोस्ड विद अनीमिया इन प्रेगनेंसी, दिस टेस्ट मे हैव टू बी रिपीटेड मच मोर. सो मेरे काफी सारे पेशेंट्स मुझे ये क्वेश्चन पूछते हैं कि अनीमिया ना होने के लिए या हमारा आयरन बढ़ाने के लिए या हीमोग्लोबिन बढ़ाने के लिए हमें क्या खाना चाहिए. तो काफी फूड स्टफ्स होते हैं जो आयरन में बहुत रिच होते हैं. जैगरी या गुड़ जिसे हम कहते हैं, इट इज वेरी रिच इन आयरन. ड्राई फ्रूट्स जैसे डेट्स या खजूर, ब्लैक रेजिन्स मतलब काले बेदाना या काला मनुका जो हम मराठी में बोलते हैं, दे आर ऑल्सो वेरी रिच इन आयरन. Certain nuts like walnuts या अखरोट या pistachios or pista are also rich in iron. Green leafy vegetables जो अपनी हरी सब्जियां होती है, मेथी, पालक, इवन मिंट एंड कोरिएंडर जैसे पुदीना और कोथिंबीर जिसे हम कहते हैं, all these are extremely rich in iron and should be part of your diet. इधर काफी जो हम धान खरीदते हैं या wheat और rice can be enriched in iron and they are available in the market as well. All are pulses जैसे मूंग, मटकी, छोले, राजमा, all these are extremely rich in iron and should be eaten. For somebody who is a non-vegetarian, जो non-vegetarian खाना खाते हैं, eggs again, chicken, mutton are all very rich in iron. The bone marrow part of it is extremely rich in iron and should be taken. और आयरन बढ़ाने के लिए आप क्या खा सकते हैं. विटामिन सी जो होता है, भला आप गोली खाइए या आपके खाने में विटामिन सी का इस्तेमाल कीजिए, इट हेल्प्स टू इंक्रीज द आयरन एब्जॉर्प्शन इन योर बॉडी. मतलब आप जो भी चीजें खा रहे हैं उसमें से ज्यादा आयरन आपके बॉडी को मिले, इसका विटामिन सी ध्यान रखता है. विटामिन सी हमें किस चीजों से मिलता है? ऑल सिट्रस फ्रूट्स, लेमन मतलब नींबू, ऑरेंजेस, स्वीट लाइम्स, ये सब हमारे विटामिन सी में रिच होते हैं. सर्टेन फ्रूट्स लाइक स्ट्रॉबेरीज, इवन टमेटोज आर अगेन रिच इन विटामिन सी एंड ऑल्सो शुड बी इंक्लूडेड इन योर डाइट. सो अभी यह सवाल आता है कि अनीमिया तो है, डायग्नोज तो हुआ है, ये सब हम खा रहे हैं पर तो भी हीमोग्लोबिन बढ़ नहीं रहा है. सो व्हाट कम्स नेक्स्ट? So obviously in every pregnancy, because anemia happens even if you do not have any risk factors, iron supplementations are given. There are many tablets which are available in the market. Depending on what suits you best, your gynecologist will advise you the same. So another question a lot of patients do have is, when is the right time that I should be taking iron? Now, iron tablets are known to cause a little bit of nausea. They are known to cause vomiting. They are known to cause gastric burn. आपके छाती में दर्द हो सकता है, आपको एसिडिटी हो सकती है, वॉमिटिंग हो सकता है. So the ideal time when iron tablets should be taken is early in the morning, preferably 1 hour before you have eaten something. 1 घंटे कुछ भी खाने के पहले, जब भी आपके पेट में कुछ भी ना हो, आपको आयरन लेना चाहिए. इसकी दो वजह है. एक तो ऑन एन एम्प्टी स्टमक द आयरन गेट्स अब्सॉर्ब्ड वेरी इजीली. खाली पेट जब भी होता है तभी आयरन सबसे ज्यादा अंश में अपने शरीर में अब्सॉर्ब होता है. और उसके बाद अभी अगर आप कुछ आधे 1 आध घंटे में खा रहे हैं तो आयरन की वजह से जो एसिडिटी होता है वो कम हो जाता है. दूसरी चीज, प्रेगनेंसी में आयरन और कैल्शियम ये दोनों टैबलेट्स दिए जाते हैं. आयरन और कैल्शियम साथ में नहीं खाने हैं. देयर हैज टू बी एटलीस्ट इंटरवल ऑफ 2 hours. ये दोनों टैबलेट्स के बीच में कम से कम 2 घंटे का अंतर होना चाहिए कि दोनों अच्छे से काम करें और उनका अब्जॉर्प्शन सबसे अच्छा हो. दूसरी बात, अगर आयरन टैबलेट से आपका हीमोग्लोबिन नहीं बढ़ रहा हो, कम मात्रा में बढ़ रहा हो या नहीं ही बढ़ रहा हो, तो उसके लिए काफी आयरन इंजेक्शंस भी होते हैं। ये आयरन इंजेक्शंस इसमें मदद करते हैं कि आयरन इंजेक्शन लेने पड़ते हैं, शायद कभी एक ही इंजेक्शन से काम हो जाता है, मल्टीपल इंजेक्शन लेने पड़ते हैं, उससे हीमोग्लोबिन बढ़ने के चांसेस 100% होते हैं, क्योंकि इसमें खाने के टाइम जो प्रॉब्लम्स होते हैं वो नहीं होते हैं। अगर हीमोग्लोबिन बहुत ही कम हो, जैसे बी अगर 7 ग्राम से भी हीमोग्लोबिन कम हो, तो शायद ब्लड ट्रांसफ्यूजन या जिसे ब्लड चढ़ाना कहते हैं, वो देना भी जरूरी हो सकता है। So I think that's it. We are now open to questions. If I can have the questions. So the first question is, should I start taking iron tablets before planning a pregnancy? So that depends totally on what your hemoglobin is before planning a pregnancy. If it's in the normal range, no, definitely not. You don't need to start taking iron before pregnancy. In fact, one point that I've forgotten to mention is that in the first 3 months of pregnancy, iron should be avoided, not because it causes harm to the baby, because in the first 3 months there is already a lot of nausea and vomiting, काफी उल्टियां, मुंह में कड़वापन होता ही है. Iron can increase these symptoms. So if the hemoglobin is fine, iron tablets are normally not started in the first 3 months of pregnancy. So definitely before you plan a pregnancy, you should get your basic hemoglobin done, which will give an idea whether iron needs to be started or not. So which doctor should I consult if I am diagnosed to have anemia during my pregnancy? A Gynec or a general physician? So if you are diagnosed to have anemia during your pregnancy, the best person to treat you is your Gynec. General physician can also definitely treat, but a Gynec will not only treat your anemia, but will also monitor your fetal growth. I mean, how fast or how well is your baby growing? So if the gynec feels that the anemia is not treated, he or she will definitely recommend you to a general physician or a hematologist to see what is the reason for your hemoglobin not increasing the way it should. But for a basic mild to moderate anemia, a gynec can definitely treat it well. I have been diagnosed with iron deficiency anemia. How long do I need to take medications? So, iron medications need to be taken throughout pregnancy. If you have already been diagnosed with iron deficiency anemia, at least till your hemoglobin is at a normal level, you need to take these medications. Also, during pregnancy, depending on whether you had a normal delivery or a cesarean section, there is an approximate blood loss of half to 1 liters, even more at times if you are having a complicated pregnancy. So iron tablets should be continued at least 3 months even after delivery, so that whatever blood loss has happened during your delivery, the iron stores are replenished. Means you have adequate iron stores. Obviously, because after delivery you are going to be breastfeeding your baby as well, so the iron levels and the hemoglobin levels in your body also will play a role in that. So it is extremely important that you take them after pregnancy for at least 3 months. Obviously, after consulting your gynecologist or your general physician, whoever you are showing. But yes, you have to take them throughout your pregnancy, definitely, and even after your pregnancy. After that, whether you need to continue or not depends on your blood reports. What is restless leg syndrome? So what happens is during pregnancy, not only is there a deficiency of iron, there is a deficiency of other vitamins as well, because whatever is there in the body goes to your baby. So sometimes there are cramps in the legs, you feel very uncomfortable. So for that, there are certain supplements that can be taken. You need to be very well hydrated. Your water intake should be at least somewhere between 2 to 2.5 liters. That is extremely important. You can keep on taking your iron, your multivitamin supplements, and your calcium supplements. If it still doesn't disappear, your gynec, your doctor will definitely advise for more supplements which will help you get rid of it. But having cramps in your legs during pregnancy is a very common thing. nothing to worry about. It is just temporary and happens because of certain multivitamin deficiencies during pregnancy. My symptoms have not disappeared even though I've started taking the prescribed medicines. What should I do? So that is a very important question. So after you start iron tablets, how long does it take for your hemoglobin to increase? So that totally depends on what your hemoglobin is when you started iron medications. Even to feel better, if you're taking your iron medications regularly, they are getting absorbed properly. It takes at least a week or two for your symptoms to disappear. And if you, for your hemoglobin to really come to a level that you want, means in a normal bracket, even after starting iron medications, it takes somewhere between 1 to 2 months for your hemoglobin to come to the level that your doctor wants it to be. So what if your symptoms have not disappeared? You need to consult with your gynec again. Maybe he or she may repeat your hemoglobin again, see whether it is really increasing or not, and then decide whether your symptoms are just related to anemia or is there something else that needs to be further investigated. Can anemia during pregnancy be prevented? Yes, it can definitely be prevented. But see, anemia in pregnancy is something that always happens. But to prevent it, you need to have a diet which is rich in iron. Once your doctor starts you on iron supplementation, they should be taken regularly without fail, should be taken properly, like I just talked about. Don't combine your calcium and iron medications. Take your iron on an empty stomach. Make sure you're having adequate vitamin C in your diet. Make sure you're having an iron rich diet, means your diet consists of all the food stuff that are rich in iron, like jaggery, black dates, raisins, green leafy vegetables. If you're a non-vegetarian, enough of portions of chicken and meat in your weekly diet. So with all this, anemia can be prevented. But if you already have anemia, it is really difficult to prevent your hemoglobin to go down in pregnancy. So it has to be monitored. But with the right kind of diet and taking your iron supplementations regularly, anemia in pregnancy can be prevented to some extent. What are the possible complications of anemia during pregnancy? Obviously, there is a risk to the mother because if she's already anemic and she has the accepted blood loss during delivery and during labor, there are chances that her condition might deteriorate. If during pregnancy there is severe anemia, there can be chances that there can be preterm labor, means the labor pain starting much before your due date. Baby's weight might not grow, means whatever the baby's weight has to be depending on the period of gestation, it may be much lesser than that. So baby's growth is definitely hampered. There can be problems in the baby which may not be detected at birth, but there can be a developmental delay in the baby if the mother's hemoglobin has been very low during pregnancy. Also, if the hemoglobin stays low throughout pregnancy, it is not growing in spite of everything. There may be need of blood transfusion during pregnancy. So all these are the complications of anemia during pregnancy. Also, if a mother is anemic and she is gone in labor, there are chances of prolonged labor, means the labor goes much beyond what is expected. The chances of postpartum hemorrhage as well, means there will be much more bleeding than what is normally expected. So all these can be risk to the mother, and the baby's risks I already talked about. So also there is no sense of well-being in a pregnancy if the mother is anemic. So all these are possible complications of anemia during pregnancy. Symptoms of anemia during pregnancy. Symptoms of anemia overall stay more or less fine. They don't differ in pregnancy. You will feel a lot of tiredness, weakness. There can be spells of dizziness. Your lips, your eyes, your nails especially will appear extremely white. You can have difficulty in breathing at times. You may have palpitations. By palpitations, I mean you may actually feel your heartbeat. You can have a rapid heartbeat, means it may beat much more than what is even normal during pregnancy. You may have sudden spells of dizziness, sudden, blackening in front of your eyes. So all these do happen with a normal pregnancy as well. But if they are happening more frequently and more severely, yes, definitely you may need to think that your hemoglobin is less or that you have anemia during pregnancy. Who is at risk for anemia during pregnancy, mom or baby? Initially, it is always the mother who is at risk of pregnancy. Like I already mentioned, when, say, for example, you are already anemic before you get pregnant, if you are carrying twins or any triplets, if your last pregnancy was less than 2 years ago, if you have a lot of vomiting during pregnancy, if your diet is less in iron supplementation, you are at more risk of developing anemia. Babies will have anemia only after birth. If a mother is anemic during pregnancy, baby being anemic intrauterine, the chances are very less. It's only once the baby comes out and the mother has severe anemia during pregnancy and childbirth, the baby might develop anemia, especially if the delivery has happened much before. Means if it's a preterm delivery, it's a small low birth weight child, the chances of anemia in baby increase further. That is why even when mothers are breastfeeding, it is important to have iron supplementation. So I think we are done with most of the questions. Anemia in pregnancy is a fairly common issue. It is something that happens in almost 25 to 40% of female, especially in Indians. How can it be prevented? Have a iron-rich diet throughout your pregnancy. Visit your Gynec as early as you know that you're pregnant. So all these factors can really be looked at. Whatever iron supplementations you are advised to, please take them properly. If you feel that you're unable to take them, you are facing a lot of vomiting, you're facing a lot of heartburn, go to your gynec, tell him or her. They will change the medication. They will help you because there are a lot of different types of iron salts which are available in the market. If one doesn't suit you, there are other options. But do not neglect taking your iron supplementations. Take them on an empty stomach 1 hour before you eat something, preferably in the morning. Make sure you're having enough vitamin C to increase the iron absorption. Make sure that there's at least a 2 hours interval between your iron and calcium supplementation. All these things together will help to prevent anemia in pregnancy. Even if you are anemic in pregnancy, it will help to increase your iron. The only take home message I would like to give you that there is no instant gratification for treatment of anemia in pregnancy. It's a slow and steady race. You have to be consistent. You have to be particular. Only then will you be able to deal with anemia in pregnancy. Thank you.